Welcome. You are listening to Caregiving Secrets with Deborah Greenhut. If you are a family caregiver or expect to be one, and you want to maintain your well-being while caring, then you are in the right place. I am your host, Deborah Greenhut, speaker, author, and rational caregiver advocate. I'm a family caregiving veteran, bringing you survival secrets and experiences from experts who share the goal of doing less by managing more. We need to invent and reinvent family care, and together we're going to do it. My big idea is rational caregiving, and my motto is, let your brain lead your heart. Please share yours in the comments. Caregiving Secrets, because friends don't let friends be caregivers alone. Let's do this. Well, I'm back now, and I'm deeply concerned, as I said, about the consequences or potential consequences of implementing all of Project 2025. And I wanted to address some of these concerns generally today and maybe take up some of the topics a little bit more specifically in a future podcast. So I'm going to talk about, in overview, what are the key proposals and my own opinion about what might happen if these things are implemented. I hope we'll think really long and hard, and those people, mostly men, who are making the decisions about how this is going to go in the future for women, are really understanding the consequences for taking away or changing or making things very different from they are now. As many commentators have suggested, Project 2025 is a fairly ideological document. It's not as focused on science and the healthcare that we know as it is on implementing a particular ideology. So one of the first proposals is to rebrand HHS as the Department of Life. So if you hear that coming, what that means in the document anyway is that it proposes shifting the mission and identity of HHS to promote instead a life from conception to natural death framing of what our government is about. So that will tilt some priorities and change our notion of what reproductive care should be. And there will be a lot of people butting in on medical decisions. Butting in is my word. Butting in on medical decisions that are best left, as far as I'm concerned, to a physician and the patient, or the patient's family in certain cases. Now, number one on the hit parade, I'm sorry, I said hot, I meant hit parade here, is abortion and contraception restrictions. We know this has been a fight. In the 50 years since Roe v. Wade was approved, more than 50 years, and believe me, I was among the marchers in that time period. So at 73, I'm really disappointed to see how the progress has been rolling back from a new generation of people who simply don't understand what's at stake here if abortion becomes somebody else's choice. So that's my 2 cents about it. What the plan will call for is classifying abortion as not health care, reinstating religious and moral exemptions to contraceptive mandates, including emergency contraception under the ACA, defending or restricting Planned Parenthood, requiring states to report the method, motivation, gestational age, etc., for abortions. Now, you've all heard probably about the problems in Texas from removing that decision from women and their doctors, how people are bleeding to death in parking lots, and it's happening in other states too. So as soon as government butts into this decision, we do have some consequences. And I personally am not sure how we can talk about ourselves as all about life if we're going to be like God over decisions of women and doctors about when a pregnancy needs to be terminated. So I'm hoping that these most extreme restrictions do not go through, but there it is, and that's the thing that we need to be concerned about. Third one would be reforming Medicaid and cutting oversight. This plan suggests caps on federal Medicaid funding, imposing stricter work requirements, elimination of pre-existing protections, turning Medicaid into vouchers, and reducing federal oversight of it. So women are overrepresented among Medicaid recipients due to conditions like pregnancy care and lack of income. The single parent household where the mom is struggling to take care of everyone. And it's going to cut access to important services like prenatal care, postpartum care, and contraception. And I'm just not sure how people are going to manage or be able to take care of each other when they're suffering from the lack of these things. And that's why it concerns me as someone who is concerned about caregiving. So even the best of share giving is probably not going to help some people. And having lived through an episode where my mom almost died on the table when she was miscarrying from a pregnancy, and she needed one more signature. She needed three altogether from a doctor, another doctor, and a psychiatrist in order to terminate the pregnancy, which was already failing. So this is personal to me, and I'm just not sure how we are going to survive in this climate again if we restore the conditions, say, of the 1950s or the 40s or the 30s. We've come some distance from that in understanding what happens during a pregnancy, and I'm not sure that we want to go back there. Now, we've been hearing a lot about research cuts for the NIH and all medical and scientific services by challenging DEI programs. And this new document, Project 2025, proposes making NIH more politically accountable to the ideology that prevails in the government. It'll make it easier to fire staff because of their relationship to DEI, remove diversity, equity, and inclusion programming from anything that's public facing or anything that can be discovered, and cutting research. So we might have once had stellar departments of research. Now we're going to have challenged departments of research if we have any at all. So you might have noticed that the western states, Hawaii, California, Oregon, and Washington, have banded together to keep a kind of CDC going. So that's a sign of life that hopefully will outlive any restrictions that come in from Project 2025. But this is a scary time for the kind of research that's needed to continue to improve women's health. It was true in the past, and maybe still true in some studies, that women aren't even research subjects when drugs are studied, procedures are studied, and so on. And women's bodies, clueless, are different from men's. So if you do a research study on men only or on white people only, you're going to come out with different results than if you included a broader swath of the population in your sample. Another aspect is discouraging gender affirming care and restrictions on LGBTQI health care, which is truly offensive. People need health care. People are sometimes born biologically different from you or I who might have gender specific biology. And for us to deny people a chance to figure out who they are as human beings is to deny the basic integrity of humanity. And this one really gets me because parents struggle with their children, children struggle with their parents, and a lot of decisions get made when a child is very young that may need to be reversed later on. So when we say gender affirming, it's not about convincing someone to become a woman or a man or some third thing. It's about helping people to discover who they actually are. And sometimes biology doesn't tell the whole story, or visible biology doesn't tell the whole story. It might be necessary to check more chemically, biochemically, what is this person composed of, and how can we help this person live his or her best life? And that's not something Project 2025 considers at all. And you may think this is way off the map from caregiving, but if you're raising a child who needs to figure this out, it's very much a part of your caregiving duties as a parent or another caregiver. Now, public health messaging and the roles of, say, the CDC and HHS, or Department of Life, as it is possibly going to be renamed. This plan argues that CDC should not issue health advice because it is inherently political. Well, I'm not sure about that. I think we have pretty good, solid evidence that vaccines, for example, save lives. And part of that example includes the fact that neither you nor I have died from smallpox, if you're listening to this. Um, and Project 2025 would like to curtail public health agencies' roles. So, a lot of women who don't have the means to go to private caregivers, private doctors, rely on guidance from the CDC. And a lot of us verify what our doctor said against what the CDC said, and we do a lot of research. If we weaken it, people will stop using services, and probably there'll be a lot more illness and heartache in our communities. So I leave it to you to start thinking about what the consequences are going to be and how you're going to vote next time to make sure that the consequences you want are the ones that are implemented. Of course, the usual problems in the community with how much sex education is too much, adolescent pregnancy prevention, those are political footballs that affect libraries, that affect people, that affect what doctors and schools can say. And I'll tell you, from having grown up in the 50s, schools didn't say enough. And the books that we could find didn't say enough about any of that. And I've been a teacher well into the 21st century now, and I know from talking with students that we still may not be saying enough, but we try to respect community standards. And sometimes there are big conflicts about this in libraries, in schools, and any other place where children gather where they could receive essential education that is vital for them to protect their own lives. This new plan, Project 2025, would require states to report the method, motivation, gestational age, and maternal state for each abortion that's performed. Somebody out there really has a thing for spreadsheets detailing women's abortions. I'm not sure what this data is going to do for anyone, and it's like surveillance over your intimacy with another person. So, certainly, we should study what happens during and after an abortion, but we should not do this for the purpose of checking up on women or checking up on the population. There are going to be some changes to Medicare and at least an optional privatization of the program. And you know that's going to mean more money from you and me. The plan now promotes Medicare Advantage expansion and perhaps reorientation away from traditional Medicare, which is your best chance of getting a full benefit or full coverage for what you need. And women certainly rely on Medicare for post postmenopausal care, as well as care along the way, so that they can be caregivers for their grandchildren and sometimes for their children. So if we don't take care of the caregivers, we're really going to be in a hot mess years from now. So these are my own opinions, as I said to you, and I hope some of you share them and think seriously enough, or at least respect them enough, to question what we are doing as we move ahead in making huge changes here. There will certainly be cuts or restructuring in the HHS or Department of Life workforce, and excuse me, and there will be reductions most likely. So the document speaks broadly of reducing administrative burden, streamlining agencies and cutting staff, blah, 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 and consolidating agencies under a reorganization. So it wouldn't be surprising, given what the other aims of the program are or the project are, that the cuts may disproportionately affect women's health, women's clinics, rural health in particular, and other women's health disparities. So, as I said, the opinions are mine, but the information is coming directly from Project 2025. I'd love to know what you think and how you think this will impact you as a caregiver or the person you love who's having to do that, or your own caregiver. So, please give us some comments today, because this is pretty serious stuff coming down the pike, and it's already started. It's happening quietly, most likely, somewhere in the basement of the HHS or in the secretary's office. And I think we should be concerned enough to make it be said out loud so that the public can judge for itself. Thanks for listening this time, and I'm so glad to be back with you, and I appreciate your continuing to follow me. Thank you for joining me today on the Caregiving Secret. I love sharing insights and stories to empower you on your caregiving journey. If you like what you hear, you can dive deeper by picking up a copy of my pamphlet, Non-Negotiables for Caregivers. Go to my website, deborahgreenhut.com, and click on the link for Non-Negotiables for Caregivers. Until next time, keep sharing, keep caring, and remember, you're not alone on this journey. Thank you for listening.